Hi, Mr. Ruxpin. My name is Jessica. I'm going to be the nurse that's going to be giving you your bed bath today. Can I see your armband? Ah. What's your first name? Okay, and your date of birth? All right. Okay, I'm going to check the computer for any policies, procedures, protocol, also the condition of the patient currently, getting an idea of what his baseline is so I can be aware of anything that he has going on, note any changes after the procedure, and limitations to mobility, all that. Okay, all right. You feel like you need to use the bedpan before we get started? You do? All right. All right, we'll get that taken care of. I'm just going to close these curtains here real quick. Lots of privacy. Make sure it's nice and warm in here for you, Mr. Ruxpin. Okay. First of all, let's start with the bedpan. Okay, I'm going to have you roll over and hold this side rail, okay? Make sure the bed's all the way up to my level. Have you roll over. You can hold on to that side rail if you want. I'm going to put this bedpan under. And you can roll back. 1, 2, 3, roll back. Okay. Cover you back up. Set your head up. Make sure you're comfortable right there. All right. Okay, here's your call light. And you can give me a holler when you're all finished. Okay. And, well, that was quick, Mr. Ruxpin. Let's take this bedspread off. Let's clean and keep it over a chair. Put your bath sheet over you. Tuck it in under your shoulders. Okay. For right now, let's get that bedpan out. I'm going to have you roll again and hold on to your side rail. Roll away from me. Okay. All right. Put that down. We have something to cover that. We're going to use some wipes and make sure that he is all cleaned up. Each movement, each stripe, each wipe, we're going to use a clean part of the cloth. Make sure to pull the buttocks apart to expose the anus. Make sure it's nice and clean. Make sure it's dry. Use as many as needed. All right. Dispose of that in hazardous waste. Okay, you can lean back now, Mr. Ruxpin. Okay. All right, so I got our shampoo, I have shampoo, I have soap, everything that we need, and we have a towel. All right, let's remove this top sheet. Okay. We have our tub of water. We have our soap. We have our mitt or washcloth that we're going to make into a mitt. Okay, this like that and over. That's how we make a mitt around our hand. All right. So we're going to first start with the face. We're going to clean the eyes, starting at the center going out. I'm going to use a different part of the washcloth for each swipe, okay, so as to not move microorganisms around. Okay, after both eyes are done, we're going to completely do his face, ears, neck, rinsing the washcloth as needed, making sure it's nice and warm, making sure the water doesn't go cold. All right, wipe this side, nose. Okay, and let's dry him off, making sure he doesn't stay wet, doesn't get chilled. Okay, wash, 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 rinse it out. Okay, Miss Rex, and we're going to do your arm now. So we're going to expose only the area that we need to, that we're immediately working on. We don't want to expose any more than that. Okay, up. Okay, wash. I'm going to get the armpit area, rinse, different part of washcloth. We're going to do the top as well, the sides, all around the shoulder. We're going to get the hands as well. I'm going to wash each one of his fingers, check his fingernails, get all that washed and rinsed, and then we're going to dry off the individual piece that we just did. Okay, moving along, we're going to do leg. This is quite a big bath towel, so we don't need to reposition it, but we got plenty right there. And there is a waterproof pad underneath this so that we won't get his bed wet. Okay. All right, so we're going to make long strokes down his leg. All right, washing in his inner thigh. Okay, if his feet need to be soaked, we can go ahead and do that for a little while. If he's a diabetic, you should have seen that in the chart. You don't soak diabetics' feet. Okay, make sure that all that's clean and dry. Okay. Do the abdomen, the chest. The chest we're going to do nice big circular motions, washing it using a different part. Side on this side, dry it off. We're going to expose the other side, circular motions, dry it off. Okay, move it down a little bit more. If I need to reposition this top sheet over him to expose the smallest amount of surface area as possible, we're going to do that. All right, so I'm going to kind of reach underneath and get the abdomen cleaned, keeping my mitt intact. Okay. Right, noting any skin changes, any redness areas, any bruising, visualizing each individual part, doing a thorough assessment along the way of doing a bed bath. Okay, now after we've done the head, we've done the arm, we've done the chest, the abdomen, we've done the leg, we also need to do the perineal area. Okay. If there's any noticeable fecal matter on male or female, you're going to want to use a disposable wipe and clean that off first. so we don't contaminate the water. Okay, so we're going to start at the very tip of the penis, and we're going to work away from the opening to the urethra. We don't want to introduce microorganisms into the urethra, possibly creating a UTI. So we're going to do the head. After the head, we're going to move down to the shaft, and we're going to clean that, all the while checking our water temperature, nice and clean. Okay, that part's dried off. Okay, we're going to move down to the scrotum area, making sure to clean along the creases and the crevices of his skin. Okay, looking for redness, tissue breakdown, all of that. Okay, let's get that all cleaned and dry. Nice and dry is a very big deal. Okay, and during the bed bath, if you need to, if you at some point clean the anus, you would need to change your water. You don't want to cross-contaminate. So those are all things to pay attention to. All right, so now we're going to get you all in new clothes, put your bedding back on, all of that. Okay. Did I get his waterproof pad wet? I don't know. Let's check. Okay, you can roll onto your side for me, Mr. Ruxpin. I'm going to take this sheet out, or this towel out. Okay. Let's put that. The dirty clothes. Oh, nice and dry. Okay, you can roll back now. We're going to put a new gown on you, paying attention to any tubes that need to be passed through the armholes possibly. All right, so once the sheet is back on, we can go under, we can move that bath towel away. All right, and replace the blanket, folding over the top to make that smooth edge. Making sure he is comfortable in his position in bed. He's clean, warm, dry. Okay, I'm going to document the procedure, how well he tolerated it, any new findings that I came along. We're going to put his bedroom back together, gather all of my materials and supplies. We're going to remove of this bedpan. Place his side table next to him. Put his bed all the way down to the floor. Make sure he has the things he needs close to him. Make sure the bed is still locked. Everything's clear. All right. Okay, Mr. Ruxpin, you're all nice and clean. Remove gloves. Sanitize my hands. And we're good to go.